Good morning. I think we're ready to get started. Thank you all for being here today. My name is Carrie Harrison, and I'm the Deputy Chief of Staff for Senate President Therese Murray, so it is my great pleasure to be here with you. Today's session is actually entitled Entrepreneurial Innovation in Healthcare Collaborations, just to discuss funding, opportunities, and international trade. So as many of you know, these past few days have shown countless examples of international collaboration, and Massachusetts is very pleased to continue those conversations with the companies that are here. So joining me today, there are 4 expert panelists that will take part in this discussion. They include Dr. Vincenzo Gula, Paulo Ferreira dos Santos, Brendan Seaton, and Ann Avedon. And so I'd like to give a brief introduction about each of our panelists, and then they will have time to introduce themselves and what their projects are and their role in collaboration. So I'll begin with Dr. Vincenzo Gula. He is the CEO and co-founder of Aditech. It's a 2006 startup company with the Austrian telemedicine company Zydrachron. Today, Aditech is a leader in telemedicine solutions in Europe. Dr. Gula is here as an Italian representative of the European project JADE. He tells me he's very happy to be back here in Boston. And JADE is a project that is focused on e-health for silver aging. Paulo Ferreira dos Santos is the CEO of Kinematics. He has started 5 companies, but he is now exclusively the CEO of Kinematics, making sense of body dynamics. This is a Portuguese company that develops electronic devices for monitoring body dynamics with applications in healthcare, sports, and consumer markets. Kinematics has subsidiaries in Sheffield, UK, and soon here in Boston. Paulo holds a degree in computer science and management and a Master's of Science in Innovation and Technological Entrepreneurship from the University of Porto, Portugal. Brendan Seaton is the president of ITAC Health, the health division of the Information Technology Association of Canada. He has more than 30 years' experience in health service administration, information system project management, and information privacy and security in both the public and private sectors. He's been a leader in the development of health IT standards, particularly in the area of security and privacy. Brendan has also held senior management and executive level positions in Veterans Affairs Canada, Ontario Blue Cross, and Ontario Smart Systems for Health Agency. He is an instructor at the National Institutes for Health Informatics, teaching workshops and webinars on e-health, privacy, security, and risk management. And Ann Avedon is Vice Consul Trade and Investment Officer and USA Sector Lead for Healthcare at UK Trade and Investment. Based at the British Consulate General in Boston, Ann consults with UK companies on their international business strategy and helps them commercialize their medical devices and technologies in the US market. She also works with US firms to help them understand the strengths of Britain's healthcare and life sciences sector in order to promote cross-border collaboration and inward investment into the UK. She has hosted many successful trade missions, ministerial visits, and think tanks for industry executives and policy leaders. Ann has a master's degree from the University of Westminster and is an active member of the Massachusetts Medical Device Industry Association, the Medical Development Group, the New England Health Information Management Systems Society, and the Massachusetts Technology Leadership Council. Please join me in welcoming all of our panelists. So we'll now begin with some brief presentations from each of our panelists, followed by an opportunity for open dialogue and questions from our audience. So if you'd like to start, Dr. Guler.
Thank you. Well, first of all, I want to thank you for giving me this opportunity to speak here, and again for making me come back home. I mean, I've been missing from Boston since almost 20 years, so it happens to me to travel around the world, and sometimes it happens also to come here. It's the first time. So it's nice to be back home. That's for sure. So let's say one thing. First of all, as I was introduced, I am representing the JADE project. What is the JADE project? The JADE program, sorry. What is the JADE project? The JADE project is an European project that's led by the Italian Marche region government to, let's say, promote networking between entities and companies, enterprises, in the field of telehealth and aging, and silver aging. That is to say, there is a number of initiatives that are being done, both in Europe and also overseas, like this one here, and involves 5 countries mainly. One is Italy, of course. The other one is UK. We have Turkey, Finland, and the third one is France. So this is what the aim of the company, of the project is. Of course, from our point of view, that means the possibility to network with someone else and also to exchange views in terms of what's going to happen in telemedicine and e-health. Me, myself, I have more than 15 years of experience in this particular subject, in telehealth. I also have written 2 books on the networks for telehealth for hospitals. And what I can say is that I really see today the possibility that telehealth is taking a big chance. Probably what is missing at the moment is, talking from a European point of view, is a certain type of guidelines. What do the governments really want us industries to do? I don't know if this is the situation also in the US, but my feeling these days is that more or less we're all in the same kind of field. Therefore, what else can I say? That we have thinking of inventing new systems, and I hope we didn't invent the wheel again, put together a number of technologies that are the most, let's see, evident, the most cutting-edge technologies that go from video communication to wireless to wearable things to comfortable, invisible wearing sensors and so on. But in effect, I think this we can share, all the people that are here can share that, telemedicine up to now did not take a big move forward. And I hope that this event will be one of those events that will help us out to do something better.
Thank you. Paolo?
I will say only some few words to say that I'm really honored to be here, because this symposium is an event that I simply love. I'm really double happy because I became aware of this symposium 3 years ago, and I was invited to come to here by Hannah Vidon, that is on my side. And also because I have never been moderated by a so beautiful moderator like Gary Harrison. I run a startup on a very hard and difficult field internationally, in America, but also in other places. So we have a subsidiary in UK, we are based in Portugal, and we are now investing a lot also in the American market, and it's so challenging, so difficult, that this symposium opens me the opportunity of discussing and contributing for a debate in a very positive way to see if I can contribute also to eliminate some barriers for my company, but also for others that are full of talent and with wonderful technologies that can improve our lives now, but also in the future.
Okay.
In my role in trade and investment, working with UK companies, looking at the US market, I've really seen an interesting trend. The focus today is around entrepreneurial innovation in healthcare. And what we're seeing is that a lot of the innovation is coming from the small to medium-sized enterprises in the US, in the UK, all of these spin-outs that really have the potential to transform healthcare and are part of the solution. The challenge is that for many companies that are based overseas, when they're looking at the US market, they're looking at country risk, they're looking at market risk, they're looking at technology risk. You know, we've heard a lot about risk and risk shifting through the system. And I think for small companies where they're venture capital backed or, you know, that they're bootstrapped, etc., they have a technology that is transformative, but for them the real challenge is, how do I get noticed? How do I get uptake and adoption in the US health system? We know that it's fragmented. We know that there are groups like the Mass Life Sciences Center and the Massachusetts Office of International Trade and Investment, and there are groups to help out. But fundamentally, you know, for many of these companies looking at the US market, the question might be, do I partner with a system integrator? And if I do partner with a system integrator, you know, what standards, evidence, what information do I need to give them to get a chance of getting their attention about my product or technology? If I am selling directly into the health system and into clinicians, how do I find a clinical opinion leader to believe in my product or technology? There's confusion around value analysis committees in hospitals. So right now, should I be going to Partners Healthcare and speak to the value analysis committee and say, this is the economic business case about why you should adopt my technology? So it's very confusing for companies that are trying to get funding, trying to get traction, to really understand what's the best route to market and how do I basically stay funded and get over that chasm to really ensure that I can get the uptake and adoption that is going to transform the patient care. So you know, so in terms of what I would like to get out of the session and the interest that I have is, as we're looking at entrepreneurial innovation in healthcare, the entrepreneurs have so many challenges. There are systems around, you know, the British government, other foreign governments, groups like JADE, etc., that are here to help. But one of the things that struck me in the previous session, which is where the question was asked, well, I've got the evidence that shows that my technology works. How many times do we have to go through this process? And, you know, it seems to me that maybe one of the roles that government could play is almost doing something a bit like the Continua Health Alliance, you know, in terms of interoperability, which is saying, you know, let's look at those 5 national breakthrough technologies that are really going to make a difference, that have got the real-world evidence, the clinical impact, and how do we start maybe getting some kind of seal of approval or recognition out there that makes it easy for health systems to pull through these technologies. So my goal is to really start thinking about some solutions that can help innovators, both US innovators looking at international markets and international companies looking at the US market. How can we start being smarter around how we leverage the opportunities? Thank you.
Okay, thank you. Thank you, Carrie, and good morning, ladies and gentlemen. I represent ITAC Health, the Information Technology Association of Canada, and we've got about 350 members, mainly representing the large multinational and large Canadian companies who are actual members of ITAC. But we do represent the probably 4,000 to 5,000 companies who operate in Canada, most of them small to medium-sized enterprises, who are trying to make some form of an impact in the Canadian health sector. I'd like to start my remarks by just clearing up a couple of misconceptions perhaps about the Canadian healthcare system that are rather common. First of all is that there's no single monolithic Canadian healthcare system. You know, in Canada, under our Constitution, the jurisdiction for healthcare is with our provinces and territories. So we don't have a single Canadian marketplace or healthcare system. We have actually 13. If you add the federal government, which actually has a significant involvement in providing healthcare for war veterans, for for First Nations communities, for people in our military. That represents 14 different jurisdictions, 14 different marketplaces that our members have got to try and work into. Another misconception is that we're a fully publicly funded health system, and that's true with respect to acute care and primary care, but about 30% of Canadian health care comes from private sources, either from insurance companies or for people paying out of pocket. So there's a significant involvement of the private sector still in Canada, which is largely regarded as a publicly funded system. Now, this creates some challenges for Canadian companies. We find that companies that are selling purely into a local or regional market don't have the necessary heft to basically survive in the long term. Companies that survive are selling into a national marketplace, which means that they're having to comply with requirements of 13 or 14 jurisdictions. And the companies that are thriving, are exporting, are actually selling outside of the country. So in growing the Canadian health ICT industry, we really have to look at how do we enable or help our companies to market more effectively in other parts of the world. So who needs our help? Well, the big multinationals don't need our help, that's for sure. They've got their own presence in many countries around the world. They've got significant experience dealing with government relations and government regulations and that. It's really the small to medium-sized enterprises that need our assistance. And I'd like to sort of postulate or throw out for today two things that we have found that are needed in order to enable small to medium-sized companies to actually succeed in a global marketplace. First of all, we've got to promote common standards, common international standards for ICT products and services. And we're starting to see some of this happening today with groups like HL7, like SNOMED, like DICOM. There is a significant amount of work going underway. But what we have to make sure is that companies that are building products in Canada are building to the same kinds of specifications that we're going to be seeing in other parts of the world. So this harmonization of standards is really important. Related to that is an alignment of the licensing and certification schemes internationally. We know that there is significant interest now, and there's a lot of activity underway at the international level to actually license and certify healthcare software products. And we certainly believe that it's necessary to make sure that countries are collaborating and cooperating to align those certification and licensing requirements so that companies only need to go through it once. So a company from the United States that wants to sell into Canada has licensed or certified their product in the States. That should be accepted in Canada and vice versa. Canadian companies are going to the United States or Europe should be able to rely on the certifications and licensing that has taken place. The second thing that governments and associations should do is to help small to medium enterprises develop their sales and support channels abroad. And we're seeing a lot of this at this conference. This has actually been very positive for a number of Canadian companies who I've been talking with over the last few days here. What we find is that small companies have great ideas, but they don't have the necessary infrastructure needed to scale, to sell, or support their products in foreign markets. So that is almost it does require that there be partnerships, that there be work on helping companies to find channels that will enable them to get their products into the global economy. So I'm just going to conclude my remarks there, but I look forward to the discussion.
Great. So one of the things I think small businesses are generally challenged with are their funding sources. And so I'm wondering if you, the panel, can discuss a little bit about the emergence of new business models and how some of these other funding sources can assist in these entries into new markets. For instance, Horizon 2020 is coming up. So would anyone like to tackle that?
This is the critical point. In fact, the business models and for a company like mine that has been very active In Europe, initially, is really tough. For example, we go to Belgium, and they have one business model. We move to, and this is a small country, we move to Holland, these totally different rules, totally different business model. And this makes me thinking that it's very difficult to beat McDonald's or Burger King or whatever, because they are the same in all the countries, and the healthcare that is to avoid their consequences is so different in some places. And this creates an extra difficulty for getting money or from the investors, because if it is so hard to get in the business model and get sales, this is not attractive for the investors. One of the things that, in my opinion, is critical, and I come from a small company, so I must say it, is I think the healthcare system worldwide faces a problem of competition. And everything is based on barriers to keep the players that are in the market in a better position. And all of us, as or patients or potential patients, that will be all of us, don't like the word competitions on this, but all of us, we use excellent smartphones nowadays because of competition. So they are stronger, reliable, and less expensive. And based on the ideal that we are taking care of the patient safety, and we create wonderful barriers for the big companies that are in the market. So they don't need to innovate. They simply don't need to reduce the costs, because they have less players that they could have if we have simpler and clear business models. Sometimes based more in common sense than in heavy science, because the science is also another barrier. We can assess and reassess, like Anne said, and anyone can always refute what is there, but there are things that all of us with common sense can understand that could simplify our lives. For example, if I'm with fever, nothing special at home, why I cannot see my doctor through Skype or other system? Why I need to go there, open a queue, create problems, have some burden in bureaucracy, and contribute to damage the environment because I need to go in my car or whatever, for a thing that I will be there waiting for 2 hours, seeing a doctor for 5 minutes, and I come out with a pill that will solve my problem. But this issue of the business models, of understanding, there are countries that I still not understand what are the business models to sell. I have had in a lot of countries in the world hilarious meetings that I have people in front of me, doctors and nurses, say, I want to buy this, and say, how can you buy it? I say, I simply don't know. So if they don't know, how can I know? It's very, very, very difficult. And I think there is also an opportunity to disrupt potentially the market if the authorities and official authorities, because this is a regulatory-driven market, can help and contribute, and thinking more on the interests of all of us that are the patients, and less on a few that are taking huge benefits from this.
I'll just jump in. In terms of funding, and I'm not sure that this is so much around the new business models, but what we've seen is, you've got the traditional venture capital funding that, with the market over the past few years, their attitude to risk has certainly changed. And I think that for many of our companies, with Mass Life Sciences Centre, with the British government, there's a lot of funding available for very early stage, seed stage, proof of concept. But it's really, for many of our companies, they've got a product or technology, and they're really needing that extra funding to scale up. And they can be creative. They might go to corporate venture capitalists where there's a much more strategic fit, where they would be willing to make a commitment. But the problem is with a corporate venture capitalist, that they may be looking for a locked-in IP position. Even the CVCs are going to be a little more risk-averse if the new technology is going to involve a regulatory clearance from the FDA, or if just if it's going to change patient pathways or something that adds to the risk for them in terms of pushing this out to a clinical setting. So, for companies as they're looking, the SBRI type grants, etc. But I think it really is a challenge getting, across the valley of death, if you will, and maybe some crowdsourcing models are emerging, etc. But, governments do play a role, but we do find that there's a gap. Within the British government, we have people in market in the US that are focused on engaging with the venture capital community, talking about some UK innovation in terms of deal flow, because many US venture capitalists aren't always willing to invest in overseas companies because of the added risk. But we are trying to put people in place in the US market to be able to showcase deal flow of those really cutting-edge breakthrough technologies.
About a year ago, we had a roundtable with a number of small vendors, primarily in the EMR or physician medical record or medical office space. And it was kind of interesting. One of the key sentiments that came out, and I recall one of the members being very clear with this, is he said, we're not really here looking for government handouts or anything like that. What we want is the opportunity to sell our products. That's what we're really focused in here. And although some of the government programs, we've got some excellent government programs in Canada that provide a leg up to companies wanting to get get them involved with export opportunities. Really, the best thing that we can be doing for our members or our companies is to work at removing those trade barriers, to enable them to get involved in the procurements that are going on all around the world. A lot of the innovative funding that's happening right now, it's really just it's the tip of the iceberg in terms of the amount of spend actually going on in health IT. We've got significant, billions of dollars being spent in health IT that are outside the purview of these small innovative projects and funds, and that somehow we've got to get our small companies in front of the people who are actually purchasing and procuring things, and enabling processes that let them get a fair shake when it comes to pitching their product in this global marketplace.
Great. I know that in Massachusetts, the University of Massachusetts system has begun a number of incubator sites to try and support those startup companies as they try and get their roots here in Massachusetts. And I think that's another good resource. You'll find also the Cambridge Innovation Center, and I'm sure many of you are familiar with some of our sites, but certainly the funding piece and then the grassroots support to try and get your product to market. So. You raised an interesting segue for me right into sort of the barriers to trade. Some of the things I'm hearing common theme-wise are standards, harmonizing those standards. Interoperability was a big word we've heard this week. And wondering if you can maybe share some of those barriers and possible solutions to moving forward through those.
Well, yes, again, honestly, you hear me? Okay. Well, what I can say is this, that it's true, interoperability is an issue. It's true that technology is often you have different technologies, they don't talk or they don't speak or they don't, are not able to share data one to the other. But up to now, this is something that can be solved. It's another question. From a technology point of view, there's really no problem. What I think is really missing, and I come back to what I was saying at the beginning, is that nobody's really asking us for the solution. At the moment, what has happened is that most of these small and medium enterprises that, I must say one thing for them, in favor of them, that being a small, medium enterprise today gives you the possibility to be really fast on the market. That's for sure. And especially to be really fast in technology and to be fast with a solution. But this is not enough, unfortunately, because everybody of us will be able to build a solution, but nobody's going to use it. Why? Because probably we are completely out of the target. Probably we're not doing what the doctors want. Probably not doing what the hospitals really want. So it is true. It is a matter of standards. But who is going to give us the issues and the guidelines for the standards? This is when I first make my introduction. I said, what is missing really today is a common sense of guidelines. Someone is saying to me, I want to make the measurement of your pressure 3 times a day because you have hypertension, or I need to measure your activity 5 times a day because you're a lazy guy, you don't consume enough calories per day. I mean, someone has to give me these type of issues, tell me what they really want. At that point, technology is ready to follow the issues and do it. Just to give a brief example, in my experience, I made probably one of the one of the systems that today is most advanced because it works on video communication, but video communication from a TV set, and is able to put together thousands of users all together, and even doctors making a community. Now, this is a beautiful system, it's easy to use, wireless, everything that I want, but again, I have big difficulties to convince doctors and to convince hospitals to buy it, even if it's easy and everything, because on one side the doctors say, wow, beautiful, but who's going to pay for that? This is another issue. On the other side, wow, beautiful, but would your system be able to integrate my blood pressure, the one I bought the other day, and it cost me? So, I mean, all these things have to be told to the industry, is saying, yes, it is able because it has this standard, A, B, C. So you just plug and play. It's not, not a matter of technology, but maybe a matter of rules and guidelines.
Sorry, I don't agree. I think it's a problem of money. It's a problem of business model. It's a problem of business, again, from the business model. If I create incentives to treat, nobody will prevent. Not because they don't know or because there is no science that you be used to prevent or whatever. It's because the money is dropped on the wrong basket. Simple as that. And this happens everywhere. Here in America, in my country, in all the countries that I know. Most of the problems on healthcare are based on the wrong incentive. And I'm suspicious that sometimes this wrong incentive is to put someone more rich, is my point of view. But because I give a practical example. I deal with diabetic foot patients, and diabetic foot patients in America has the best research on this about how to customize a shoe for a diabetic foot patients. Look for what Medicare is reimbursing, and it is against the science. So, and still there. So there is no. I'm okay because I don't sell this also. I can say this. And most of the problems is not convincing the doctor or whatever. Is exactly convincing the person that passed the check. And this is normally this person doesn't understand nothing about medicine or whatever. Is my point of view. And the technology cannot solve this because it doesn't matter how good you are, how better you solve the problem. You are against the financial incentive, you will never sell it.
Well, probably you misunderstood what I was saying, because my idea was, it's true that if everything is in somehow standardized, me and you can talk on the same thing. And I can, at that point, help the doctor to choose his best solution on the basis of what his requirements are. So I also agree there's a question of money, because we don't know who's going to pay it at the end. It's going to be a private entity who's going to pay it. It's going to be a public entity who's going to pay it. Up to now, nobody's paying for telemedicine. This is for sure, unless you go to a private people. I don't know what happens in the United States. That's for sure in Europe. And if you don't go to an European project that will finance you to build some kind of network that maybe someone will use, maybe someone will not, there's no other money around. And that's one of the penalties that is working today. Then, it's true also that I have to speak first with the doctor to understand what he really wants. Otherwise, I will invent again, and I'm sure about this, I will invent again a wheel of another color that nobody will use, because it's not worth to spend money to invent things that already exist. What we really need to do, again, is find a way to make doctors that are our customers use telemedicine for their customers that are patients. So this is what is really missing, in my opinion. And that's why when I say I need guidelines, I need someone that will tell, doctor, you are going to use a telemedical system. Why? Because you're going to save a whole bunch of money from one side, you're going to improve the quality of life of the patient from the other side, and in the meantime, we'll all live together, we'll all live happy, because he's going to live in his house and he's going to have a better life. You are going to live in your office and you're going to have a better way of working. And in the meantime, I could build a whole historical issue for the patient that is, today's in the United States, tomorrow he's going to be in Florida, tomorrow he's going to go in Europe, and probably he'll have a piece of card that everybody go in his pocket, wherever he goes, everybody knows exactly what is needed. This is the common vision. This is what I see. Then everything else, again, I fully agree with you. No money, no camel. That's what they say, we used to say in Asia. You want to see a camel, you need to give him money.
I think you've highlighted the balance we have in government, at least, in terms of trying to offer up regulatory solutions that keep the market moving, but also don't prevent or stagnate the competitiveness to always improve. So it's a delicate balance there. Does anyone else want to comment on that?
You know, I think that the role of governments is to kind of create the infrastructure and environment that is conducive to helping companies and you know, trying to address these interoperability and standards and these barriers. But almost more than that, what I see is often a lot of the companies have invented a technology, they're passionate about it, it came out of their garage, it's prevailed, and they come into a market, and we see this US companies going into the UK companies coming here, where they go into their elevator pitch and they see the Kaiser Permanente person or the Partners person, and immediately, this is my technology and this is what it does and this is going to help solve all your problems, without actually really understanding what problem are they trying to solve. You know, and so you know, and I see it at trade shows time and time again, instead of really listening and knowing what that company's strategy is and how this might tuck in, and actually being well educated about what's the reimbursement or what might be the barriers, and actually better mapping, because I think that our companies would do a better job just being a little bit more prepared. And once they have done that, also being open to new risk-sharing models. You know, so for example, you know, we've heard a lot about evidence, and you hear now about real-world evidence and risk-sharing, etc. And, you know, even in like the previous example where we have seen, I've got a technology, it works, it delivers patient impact, you know, really trying to be creative about saying, all right, we'd love to work with you, and not so much the pilots and the demonstrators, but let us know how we can take on some of the risk or risk share in a way that can really get you in and start getting that evidence. And then what you have is one clinical center that's influencing another clinical center rather than you selling two. So just some thoughts.
I know that this is a lively discussion here, but I'd like to open it up if there are any questions from the audience, because we're down to our last say 5 minutes, if we could do.
I had a question. My name's Davis Graham. I'm at Brandeis University, as well as Manatee Diagnostic in Bradenton, Florida, outpatient radiology. Have you all considered when, let's just take one small step, like a EHR, that when somebody goes over to Europe from the US, there is a data line that would allow us to, if they get ill in one of your countries, that there would be that access to that information. Has there been any thoughts about that, or?
Well, yes, there's been thoughts already in Europe of how can a European citizen travel from Italy to France, and in France a doctor can understand what the hell happened to him. I guess that to do it overseas is going to be a big difficulty, but if you give us time, maybe we will be able to solve our own problem in-house. Then we'll try to do it, but I fully agree with you. Today, there's technology, it's easy to do that. It's really fast to do it. But the big problem here is, again, of standards, is, again, of what are the rules to protect the data in the US, what are the rules to protect the data in 20 different countries in Europe. You have to. Europe is a union, but it's made of 20 different countries with 20 different laws, with 20 different governments. It should be one day a federal state, but it's not there yet. So you understand it's really, really difficult. The best thing is that you put in your pocket a USB pen, okay, with a Word, I would say a Word or Excel tablet. If you have Mac, maybe you'll have some difficulties. If you don't have Macintosh or Windows, you may have some translator. And that is the best way today to go around and say, this is what I have inside. Now, and these are my RX Image. You can do that. It's really easier.
Yeah. Okay. Thank you.
Everybody for his own.
Certainly in Canada, we found that the technology issues in terms of those kinds of exchanges are, I wouldn't say they're trivial, but they're manageable. They can be overcome. The real issue is in the management of the policies between different countries, particularly with respect to issues of privacy and security, the safety of the service, the management of the information and data. That's where the issues are. And when we start talking about harmonization of policies and standards and things, that's really what we're getting at. We have to have a common set of rules in order to exchange information between countries. We find even in Canada challenges going between different provincial jurisdictions because the privacy legislation is unique to each province, and it's, while at a 50,000 foot level it all looks the same, when you get right down to how you handle consent or handle data breaches or things like that, there's just enough difference to make it difficult to communicate.
So this concept of, is this on?
Yep.
Yeah, okay. So this concept of the role of government in spurring innovation is really an interesting one. I hadn't thought of this before, but I'm curious as to what the thought is of the panelists in connection with what I will call governmental challenge grants. Challenge credits. So this is not necessarily a corporate R&D credit, but maybe an individual income tax credit. So the challenge might be diabetic foot, we have a problem there, or cardiovascular disease, we have a problem there, or neurodegenerative disease, we have a problem there. So here's a grant or a tax credit from the Commonwealth of Massachusetts, from the United Kingdom tax system, from the Canadian tax system, where if technologies are brought to fore, there will be no income tax assessed on those who bring that technology forward, much like an R&D credit. Curious as to what your thoughts are on that. And Carrie, you in particular are thinking about attracting new businesses to Massachusetts. Might this be a creative idea? But all of you, I'm curious if anyone has any thoughts.
Does anyone want to take that?
Right. This is, in my opinion, the problem is not, I have never seen so many grants. In America, I don't know enough, but in Europe is amazing. The amount of money dropped in grants to develop medical technologies. And this, again, creates other beneficiaries. And some of them, for example, I have the impression that hospitals all around the world, they found a new source of income. Is selling the use of their patients for clinical trials is a new source of business. And this item is not clear, they don't assume it, and it is why Anne is right. We arrive in 20 places and they want to repeat the same thing that we have done in the last 19. Because there is money, grants for that. And I want to open the discussion that we can begin looking to grants as part of the problem and not part of the solution. Because this creates this kind of beneficiaries, but doesn't solve the other problem. The best source of funding that I'm looking for is customers, is come from customers, not from public money. So I don't understand why we spend so much money in creating technologies and supporting the invention of technologies and innovation, and after we create barriers to never being adopted. I think some of this money and where I think some grants could be is identifying what are the barriers to the adoption and simply eliminating them. I don't know if it is possible or not in terms of policy, but maybe changing the incentives. I don't know, because some of the problems, as I say, are not solved for lack of technology or knowledge or capabilities or whatever. Still be because more barriers. There is a business around the barriers. There is a business around the standards. What is the point of making a standard if there are 2,000 standards that I can follow? So there is no standard at all. And all of them are earning money, is where I think the grants and the systems can be very effective, can help a lot companies like mine, but can help a lot if we can help solve the end of the line, is someone will adopt it. If it is good. If it is not good, we need to do another thing in our lives.
Personally, I believe that the best challenge and the best grant that a government could do, or whatever it is, wherever he is that he recognizes the use of such technologies in medicine. At that point, there will be a reimbursement for any type of use, and at that point, any company would invest because it knows that his solution, once the doctor will buy it and the hospital will buy it, and somehow will be refunded to the doctor, to the hospital, and then the business goes on. This is what I really think. I mean, it has to be a win-win in both parts. The doctor will need to have a good solution that someone's paying him, and the company that develops this will have someone paying on the other side. I think that we can all share this. If there's money in on the basket, the solutions come out, and if they're paid, everybody will put the best solution it can on the market. So even though the grant in Massachusetts, I saw that many startups have a different history here, in an easier history here in U.S. Compared to Europe. I must say that. I must admit that it's really it's completely a different culture from that point of view.
Okay. Unfortunately, we're running out of time. I know that there are some waiting for questions, and maybe our panelists would be willing to stay on and talk further. But I think if we could just have a sort of closing remark from the panelists, if they'd like to add anything, maybe a call to action. It sounds like there's more discussion that needs to take place and some solutions that need to come out of these discussions.
Call to action. Sorry, I don't know if this is on. You know, what we've heard over the past 2 days is around patient engagement. It's about peer-to-peer support and people helping each other to really start tackling this. And I think for entrepreneurs and innovators, you know, what they would really benefit from is some peer-to-peer support. And by that, again, I think of UK companies that are coming into the US market. You know, if we could start getting a network, and I know everyone's fatigued with all the LinkedIn demands and so on, but creating a group where people that have been serial entrepreneurs or have been successful, or clinicians, or people in the ecosystem, it might be, in our case, British expats that are living here, that have failed, that have succeeded, that can share lessons learned or just help give some checklists or just provide some guidance. Because I think all too often, you know, one of the areas where we fall down is just not helping each other. And I think, you know, we've got the government infrastructure and support like Mass Life Sciences Centre and folks like myself and the Canadians that are here to provide support. But I think where business really benefits is being able to tap in to lessons learned, common mistakes made, what can I do differently? Because in many cases that can shave a year of struggle off an entrepreneur's life in terms of just knowing that key strategy that someone would have done differently or something they would have done differently that really gets them through.
Anyone else?
Yeah, I'd like to sort of, my call to action would be to really promote a free trade in health information technology. I think that's something that is going to benefit all. Certainly in Canada, we want the best that the world has to offer. You know, when I go into Toronto General Hospital or to any other facility in Canada, I'm expecting the best, not just made in Canada solutions. Similarly, though, Canada wants to offer the best, or to the world, the best that Canada has to offer. And by governments and other agencies really looking to remove these barriers, and I guess we'd refer to them as non-tariff barriers, things like standards, things like regulations, and that sort of thing, and get them harmonized, I think we could do an awful lot to rapidly advance the development and deployment of HICTs throughout the world?
My call to actions comes from stating that the thing that can bring more uncertainty to our lives is staying or not staying healthy. So I can live my life well if I'm healthy. I cannot live well, or in all the fields, also financially, if I'm not healthy. So even if I have interests on the business because I am in a company, my call of action is exactly that we need all to be open on the way that we want to be treated. If we want to get, because it is supposed that we are going to live on average more 20 years. Do we want to live bad or well? So we need to be open in the way that we ask to the politicians and to the people that we can influence, and in the way that we want to get healthcare services and products from healthcare that can help us in a very practical way, in a very efficient way, and economical way that we can live our lives better. So all of us can contribute for this in different grades and in different ways. And so this is my call for action. All of us or are or will be patients. And so it's our responsibility to take care of this.
Well, my words are that today, and probably you all had the possibility to make a visit to the symposium and to the exhibition outside. You see that technology is ready, is there. Technology is ready to give anything for what concerns age and assisted living. At this point, what is really needed is a business model that can make this run from a public point of view, from a government point of view, and not only in the US, but probably also especially in Europe. Once this is done, I believe that the wheel will start turning and the car will start going. This is it.
I actually have been advised that we have one guest in our audience who'd like to add a call to action. So.
Thank you, Carrie. My name is Mirena Bagor, and I've been part of the healthcare technology industry for a number of years. I'm also participating as an adjunct faculty at the MIT Harvard Medical School course on enabling technology innovation in healthcare and life sciences, and have also been involved with the entrepreneurial community in Boston. And I wonder, I have heard the same kind of concerns that companies that you have represented from your countries have talked about from the U.S. companies as well, with obviously an additional issue of dealing with a totally foreign market. And I wonder whether we could, via the course, where we actually get entrepreneurial-minded academics, graduate students, to work on a case scenario, if you would, if we could use this situation as a case scenario and develop that kind of a center where a peer-to-peer consulting of some kind would be helpful. I'd be happy to talk to you after that, but just as an idea, obviously, would be great for me to know whether you think that might work. This would be for the spring of next year.
I think it sounds like a terrific idea.
It's really good.
Thank you. So I'd like to thank the panelists. I'd like to thank the audience. Lots of good questions and good dialogue. For me, it's been my pleasure to moderate this as part of Connected Health Week here in Massachusetts and at the symposium. It's been great. Joe has asked me to make a few announcements for you. This is the lunch break. So you have until 1:05 before the next panel will start. But here in this room, I understand that the former CEO from Weight Watchers will be here talking about solving obesity. And then there are other terrific panels to follow that, from reactive to proactive, predicting future health outcomes and machine learning, and then another one on the patient voice. So please stay.